on graft versus host disease, GVHD, covering its pathophysiology, clinical features, and clinical prevention strategies. Question 1. Pathophysiology and clinical presentation. A 50-year-old man with acute myelogenous leukemia undergoes an allogeneic bone marrow transplant. 3 weeks later, he develops a diffuse maculopapular rash, jaundice, and profuse watery diarrhea. On physical exam, he has hepatosplenomegaly. Which of the following best explains the mechanism of this complication? A. Host cytotoxic T cells attacking donor antigens. B. Donor CD8 plus T cells attacking host tissues. C. Antibody-mediated rejection of host organs. D. Preformed host antibodies against donor HLA. E. Host B cells producing antibodies against donor MHC. B. Donor CD8 plus T cells attacking host tissues. Explanation: GVHD is a type 4 hypersensitivity reaction where donor immunocompetent T cells, especially CD8+, recognize host tissues as foreign and attack them. It typically occurs in immunocompromised recipients, such as after bone marrow transplant. Common symptoms include rash, jaundice, diarrhea, and hepatosplenomegaly. Why not the others? A. Describes host versus graft, not GVHD. C. Antibody-mediated rejection is not the main mechanism of GVHD. D. This occurs in hyperacute rejection, not GVHD. E. GVHD is T-cell, not B-cell, mediated. Question 2. Prevention strategy and blood transfusions. A 35-year-old man with severe combined immunodeficiency (CSD) is hospitalized with anemia and requires a red blood cell transfusion. To prevent graft versus host disease, which of the following steps should be taken before transfusion? A. Use HLA-matched blood products. B. Administer corticosteroids prior to transfusion. C. Irradiate blood products before transfusion. D. Wash red blood cells with saline. E. Administer antithymocyte globulin to recipient. Correct answer C. Irradiate blood products before transfusion. Explanation: in immunocompromised patients, such as those with SCID or bone marrow transplants, transfused T lymphocytes can mount an immune response against the host, causing GVHD. Irradiating blood products destroys T cells, preventing this complication. Why not the others? A. HLA matching reduces transplant rejection but doesn't directly prevent GVHD from transfusions. B. Corticosteroids are used for treatment, not prevention of GVHD. D. Washing RBCs removes plasma proteins, not T cells. E. Antithymocyte globulin is used for immunosuppression, not standard blood transfusion GVHD prevention. Would you like follow-up questions on treatment or complications?